From Instagram influencers to high-end wellness clinics, beauty and wellness isn't just about makeup and lifestyle anymore. It's also about IV therapies. From vitamin infusions and hangover cures to skin lightening and anti-aging cocktails, this booming market promises quick fixes in a drip. India's IV hydration therapy for wellness was valued at $38 million in 2024 and is projected to nearly double to $65 million by 2030. But as demand grows, so do concerns. Doctors warn of a rapidly expanding, largely unregulated IV drip industry, often operating without medical oversight, clinical screening, or even sometimes trained personnel. The risks: infections, allergic reactions, incorrect dosages, and unsafe administration. At the heart of this trend is glutathione, known as the master antioxidant. Medically used for liver disease, Parkinson's, and chemotherapy support, it's now being used widely and often off-label for skin lightening. In 2024, glutathione sales in India touched $13.4 million, growing at 12.7%, making it one of the fastest-growing markets in Asia-Pacific. It's apparently freely administered via IVs across salons, spas, wellness clinics, and even in home setups, often with little or no doctor supervision. It's aggressively marketed as part of glow drips, anti-aging cocktails, beauty infusions, and bridal packages that promise fairness and radiance. In fact, over half of Indian dermatologists reveal that they routinely prescribe glutathione, even though 54% admitted there's a lack of long-term safety data. Side effects can include kidney and liver issues, allergic reactions, and in rare cases, Stevens-Johnson syndrome. So today, we ask some important questions. Are IV drip therapies safe? What should we know before trying IV drips? And how do we separate genuine health benefits from marketing hype? To help us unpack all of this, we're joined by Dr. Hemant Thakkar and Dr. Satish Bhatia. Welcome to the show, gentlemen. Well, Dr. Thakkar, let me start off by asking you about your overall take on IV drips in the wellness market. What exactly happens to somebody's body when they take an IV drip which has, maybe an infusion of vitamins?
So if the last decade belonged to pill popping, this decade is solely drip driving and delivery. I have known patients who do not have the time to come to the clinic because early morning they got up after a hangover and took a drip with inverted commas. Salons, spas, wellness clinics have, without regulatory approval and clinical supervision, blossomed at every nook and corner to deliver glutathione, vitamin cocktails, all sorts of drips, peptides, so that this wellness, and this is because the susceptible years of the impressionable young folks, even the middle-aged ones, who want to overnight blossom and look like angels after all that they have gone through, has continuously allowed this unregulated, unsupervised, dose not being maintained, and that is a real danger because that provides all the problems that you just listed. It is not US FDA approved, glutathione especially for cosmetic reasons. Remember, the cosmetic benefit was an incidental discovery when glutathione was given for true medical reasons. There are true medical indications, but those indications are left by the wayside and parlors, etc., get into this.
Can healthy individuals rather be prescribed IV drips such as these?
If you ask me, glutathione should be a Schedule H drug, which should be regulated for specific indications. It is great for cancers, Alzheimer's, Parkinson's, chronic inflammation, but that is medically supervised. How much to give? Glutathione is destroyed by the gastric juice. So oral glutathione doesn't work. They've started transdermal where you give creams, but because it doesn't work orally, they give it IV. And I've known where patients say, my daughter's wedding is coming up, or young ladies say, my wedding is coming up, let me take a few drips before the big family party, before the function. Now, this is unregulated. A doctor cannot write a prescription without an indication. The indication has to be medical more than social.
Well, Dr. Bhatia, you're in the thick of things, considering that this is one of the segments that you do operate in, injectables as well as surgery in dermatology. So just give us a sense in terms of how exactly this market for IV drips, beauty drips has flourished, and especially the unregulated part of it.
Yeah, thanks, Ekta. So the global IV market is booming. In India itself, you have clinics, and wellness centers, as we call them, with IVs and popping up. They are popping up in metros and two-tier cities. And it is estimated in India itself to grow 7 to 10% annually. Now, why this happens is because of aesthetic, promotion, celebrity culture. And social media influence. So all these three together make the common man want to keep getting these injections. And sometimes they end up not going to a medical professional. They end up going to salons and spas where either the wrong dose or an impure dose could be given by untrained technicians, which is definitely could be potentially fatal.
Okay. But can you elaborate a little bit in terms of the misuse of IV drips, especially for wellness and beauty? And how has it changed possibly in the past 3 to 5 years?
Much wants more, Ekta. So many IV drip centers, they are operating without any medical oversight, or there's no protocol, or any, for that matter, even there's no licensing. There's very little regulation, and it's more of a bulk treatment being done. And first of all, we don't know, Ekta, whether these sources where you're getting the glutathione, it comes in a 600 mg ampule, whether it is sourced legally. And this, if it's not sourced legally, this can create serious health and, of course, legal issues as well.
Okay.
So this is where I will interrupt.
Yeah.
The price of glutathione is phenomenally high. So people try to procure it in the grey market.
Correct.
And there was a lot of spurious stuff coming in. An injection, as Dr. Bhatia correctly said, of an adulterated 600 milligrams can produce immediate problems. The local anesthetic which is applied before the injection, because these people want pleasure, no pain. So the local anesthetic itself can be a cardiac stimulant to arrhythmias, drops in pressure, etc.
Or even the needle, right?
Even the needle, because there is, like he said, there is no licensing. Today, I am regulated. I have a license. Maharashtra Medical Council looks at it. There is no license. You walk down a rich avenue or a sprouting complex with skyscrapers, there'll be spas and salons delivering this, because there are lots of people who, after the vodka shot party or for the Friday night party, are willing to go in and take a vitamin shot, a peptide drip, and of course, the glutathione.
Well, Dr. Bhatia, that's exactly the point that, we're trying to get to the crux of how unregulated this market is. If you talk about, say, for example, untrained personnel, are these nurses who are moonlighting and say, come to your house and say, okay, you can buy the glutathione, or you can buy the saline or the drip required from the chemist and we'll administer it for you. They see something on Instagram and they decide that this is the dosage that they want. Is that how unregulated the market is right now?
Absolutely. First of all, there is repeated use when there's no medical need. And also they're using unapproved whitening agents like NAD, peptides, amino acids, or for that matter, combining drugs. Like glutathione is frequently combined with vitamin C and steroids. There is no evidence-based protocol on this. And these are also like, as we may call them, cocktails, gluta cocktails or glow drips, which could be used weekly or even monthly. Because what happens is when you giving an IV glutathione, the results are seen much quicker than when you take any other oral vitamins, which may take even weeks or months. So this is what's being done. the bridal packages, like Hemant sir had said, it's basically the day before the wedding, they take these IV drips, which is done at home, which I find it potentially fatal. It could be potentially fatal.
But doctor, glutathione as a whole is not even approved by the regulators for cosmetic use at this point. But it is being prescribed by dermatologists as well.
Okay, it is of course done by me and my colleagues also, but we know the limitations what we have. We do a blood test before that. We take a proper history if there's any history of allergies, and only then and then we will give the right dose with the right medicine. What's happening is, especially people are getting IV based, they're getting over influenced by these influencers, bridal packages, and even the teenagers we get. So when we get teenagers coming in, we tell them, Ekta, please get your parents and come along. We need someone, no matter they offer a lot of money. We just had someone day before yesterday said, please get your parents along with a written consent, then we can think about it.
Okay. Well,
Supreme Court can regulate when an abortion should be done, when it is medically or socially indicated. Why can't somebody regulate whether unjust amounts of adulterated glutathione can be given unsupervised by unqualified professionals and mixed with anything? This is not a bar where you can add a little juice, a little lime, a little soda and make it a cocktail. It's going into the system, and that too directly. So it has to be.
But what are your thoughts, Dr. Thakkar, on the fact that this is not approved by the regulators and it's still being used widely?
So this is where I say that the regulators have to clamp down. So Schedule H has to come in. It's not only for tranquilizers and sleeping pills, but glutathione for cosmetic use, neither the US FDA nor the CDSCO in India has approved it. So I cannot see how they can do this.
Okay.
It's like those hawkers giving you Louis Vuitton bags at great discounts, which people strut around and wear so that they can fit into the healthy wannabe structure. I think this is a headlight and a tower to show people that when you go unwarranted and when you go unsupervised, the price that you pay can be with your organs, can be with your life.
Okay. Well, Dr. Thakkar, we're talking specifically about glutathione, but do you strongly or do you have the same views about any other IV drips which are available in the market, say a vitamin C infusion or...
If you give too much vitamin C, you can produce kidney stones. So the dose has to be prescribed by the physician according to the indication. And quite often, it's like going in the morning, acha thoda ye bhi dal do, thoda ye bhi dal do. So that Bhelpuri is ordered by people who are not qualified. So if you give IV multivitamin cocktails, vitamin C, vitamin E, glutathione, peptides, after all, it's like using a lot of creatinine in the gym. How many young people or wannabe muscle growers taking a lot of protein supplements come with compromised kidney function? So God made the body to take things in appropriate and apportioned doses.